This is Doctor Patient, a podcast that examines all the aspects of the patient-provider relationship. I'm your host, Heather Johnston, MD, a real-life doctor and patient. Today's my last episode of this season. After this, I'm going to take a summer break with my kids, and I'll be back later in the year with season 3. And to close it out today, I'm circling back to the basics, the doctor-patient relationship. I've talked on this show many times about what it's like to be a doctor. My favorite episode on this was episode 2, where I interviewed my own brother and heard about his ridiculously long and hard days at work as an internist. If you're not in the health field or not close to someone who is, you really don't know how unbelievably hard primary care doctors work. I'm not saying that specialists don't work hard as well. It's just that I only know the primary care world. And their life is hard for several reasons, but for many, it's because the healthcare system today puts unrealistic and sometimes ethically questionable pressures and requirements on them. I've also talked on this show about what it's like to be a patient, starting with my own patient origin story in episode 1, and then again in a bunch of other episodes, one of my favorites being episode 3, Finding Humanity in the Hospital, where my friend Grace turns the doctor-patient relationship upside down and ends up consoling the nurse that accidentally turned her hospital room into a bloodbath. But I mean, wow, being a patient today is so hard. In addition to struggling to get appointments and enduring long wait times, I'm convinced that the administrative burden of healthcare trickles down in general, from the companies that make the rules and decide how things will be run, down to the hospital staff and doctors, and finally down to you, the patient, who ends up mired in paperwork, phone calls, and electronic messages just to get your basic health care. But just recently, I re-experienced healthcare from yet another vantage point, as the doctor relative of a family member who was very sick in the hospital. And this experience brought together a lot of the topics I covered in earlier episodes: what it's like to be a patient, what it's like to be a doctor, trust in your healthcare providers, what's broken about the system, but most of all, the need for an advocate when you're sick. So I'm going to tell you about how this went for me and my relatives, and then talk about how you can help advocate for someone in the hospital yourself. A couple weeks ago, a very beloved relative was admitted to the hospital at an advanced age with some really serious acute health problems. There were so many things happening at the same time, and it was getting overwhelming pretty quickly. So I flew over to them to help translate, coordinate, and generally offer support for them while she was in the hospital. I spent most of the days at her bedside, about 10 hours a day for 4.5 days. And today, I'm letting my thoughts and observations from that experience spill out a bit. I'm going to begin with some observations about the patient experience that she had. And before I proceed, I want to say very clearly that I thought that the community hospital she was admitted to provided her really great care overall. Most of the things I'm bringing up today are inherent problems to the healthcare system itself, not necessarily anything about the specific hospital that she was in or the staff there. The reality of being sick in the hospital today, wherever that happens, is that while everyone is technically there to care for patients, as is their mission, it's unclear who's actually looking out for the patient's overall experience. What I mean is, the nurse and the doctor and the other staff members are kind and are taking actions that are all meant to help the patient. But the patient's experience of receiving all of that care can run the gamut from okay to awful. I mean, I don't think anyone would use the word great here, right? From my observations and personal experiences, this often stems from lack of coordination of care and overtaxed staff. And please remember that healthcare staff are often just as much prisoners of the current healthcare system as patients are. While I was there at the bedside, I couldn't believe how many times a patient's doors opened per day in a hospital. I wished I had a clicker with me so I could have tallied it, but I'm going to estimate that her door opened about 100 times in 10 hours, averaging out to about once every 6 minutes. I mean, sometimes an hour would go by with no one coming in. Then there were times when it was opened every few minutes for a short run. So to help you get a sense of this, I recorded a door opening and closing, and we'll be playing it in the background regularly every couple minutes throughout the whole episode so that you can get a sense of what this was like. It's hard to get rest, which you need when you're sick, when people are coming into the room very often. And many of those times she was asleep. And the things people came in for and often woke her up for were not always urgent enough to do so. But they had to do their check of whatever it was at that time because those are the rules. And so they did it. For example, in a certain 10-minute run one day, 4 different people literally woke her up from sleep. The IT guy to introduce himself and tell her he'd be working on her computer as if she cared. The nursing manager to introduce herself and ask if she needed anything. I mean, she had been fast asleep, so no. The blood draw person to take blood, understandable. And the food tray person who woke her up just to announce that she was taking the food tray away. By the way, for all of these, I was sitting there and they could have spoken to me, but they woke her before I even had a chance to intervene, entering with a hard knock or a very loud hello. Hard to recuperate from serious illness when you're woken up every 2.5 minutes. Secondly, the lack of coordination of testing was kind of ridiculous, and this happens everywhere. There was actually a day where she was brought down for a radiology based test while she had a fever and was terribly sick. And she had lots of pain whenever she was moved around because of her condition. The very kind transport team brought her back up after the test, settled her back into her room, her grimacing with the discomfort of it all. And then about 10 minutes later, another transport team came to get her for another radiology based test involving more painful moving around. Likewise, there were a few times in those first days when she was especially sick when the blood draws weren't too coordinated. She was getting one blood test at 10 a.m. and then another different one with a separate stick with a different needle at 10:30 a.m. when these very, very much could have been combined. Again, sometimes blood tests have to be done at a certain time, and that's just how it is. It's likely not any one doctor's fault, and it's possible that they were even ordered by different people, as she had multiple specialists involved in her care. But it sure would be nice if someone developed an app to help hospitals coordinate these things for patients. Business idea for someone out there. There were some strange little joys in the days, though. The last day in the hospital, all of the food came with a single beautiful orchid flower on each dish. I'm not sure where that food prep person was the other 4 days, but I was so happy they were back at work. We almost could have made a lei out of them all. What a lovely touch, though, to bring a smile as you try to swallow the hospital food. Also, she had a huge window in her room that overlooked a central, open, sunny patio. It was entertaining for us to check on the one older lady that sunbathed all day in her hospital gown with her IV pole next to her. And the extra service teams like case management and pastoral care would come by for visits that focused entirely on her quality of life right then and how things would be at home. I wondered how many of these good things were related to being in a smaller community hospital where care can be a bit more personal, but I'm not really sure. I'm going to pivot now and talk about a couple of observations I made from the doctor side of things. And I'll start by saying, wow, it is so hard to be a doctor and to have to sit at the bedside, not technically being involved. Though you're never really not involved because you're going to insert yourself to some extent in your loved one's care, from simply identifying yourself as a doctor so that people give you a little more information than they would to a non doctor family member, to actively keeping track of everything from the bedside, which I was doing. I called it quarterbacking because I had the sense that all of the teams weren't necessarily communicating with each other as well as I would have liked, so I settled into my role as the person who was coordinating behind the scenes. Now, I want you to think for a second about what you do for your job. Imagine having to watch another person do it as a fly on the wall. Think about all the things you would notice. Think about how hard it would be not to judge each thing they do against yourself, for better and for worse. For me, I don't practice medicine anymore, but when I did, I was really good at it. So I measure them all against that. Yes, I'm probably a bit compulsive when it comes to organization and planning, much to my family's chagrin, but I think people in healthcare should be and almost have to be that way today. Most of the staff people there, the nurses, nurses' aides, physical therapy, transport, were very good and very caring. The nurses were patient, though they never had extra time to stick around. There were some standouts in both directions, good and less good. There was the physical therapist who was one of the best I'd ever seen. She was so good at her actual job, but was also incredibly personable and went above and beyond for my relative, fetching warm blankets, helping her to the restroom, helping her get cleaned up, even getting her warm broth when she was cold. There were those two young men, both nursing aides, who were a little inexperienced, but so incredibly kind and warm and caring with her. And then there was the one nurse who was really brusque and bristly, the one who giggled a lot, the one who was present a lot, the one who was absent a lot. The red-headed transport nurse who was utterly fabulous. He planned ahead, was efficient, but had a huge smile and held her hand all the way down the hallway. Then there was the one nursing assistant who ran over her toes with the bedside tray cart. As for the doctors, they were all pretty good. One woman was simply joyful and explained things incredibly well. She was the only one that ever sat down while we talked. Most would stand in the middle of the room and talk to me. I kept trying that communication trick of looking at the person who should be spoken to, like the patient, but it mostly didn't work. It's either that it was because I was a doctor and it felt easier for them to talk to me, or perhaps I somehow identified myself as the alpha in the room, which is a pretty distinct possibility. They definitely, across the board, though, did not make a huge effort to talk to my relative. Granted, she was often pretty doped up, and she's quite soft spoken and takes some time to answer questions. But even when she was more alert, they still didn't really talk directly to her, which is ironic because she's exponentially more brilliant than any of us that were in that room. There was the one specialist who was so unfriendly and rushed. I think he told us he was in a hurry 4 times in the 5 minutes that he was in the room. He was altogether dismissive of her, me, and everyone else. He even criticized another doctor by name and then left without saying goodbye. We all burst out laughing after he closed the door behind him because what else were we going to do? Here's the other thing about the doctors coming in and out all day. The sink in her room was broken, so I never saw anyone actually wash their hands. But they didn't really need to, because for the most part, I didn't really see anyone do a thorough hands on examination of her much either. As far as I could tell, I was the only one to give her a pretty complete physical each morning. It's important to do one every day in the hospital because she's older and was really sick, and lots of unexpected things can pop up overnight, like rashes or a new cough or bed sores or swellings and other things. I'm admittedly a bit of a perfectionist when it comes to the basic physical exam. It seems to be widely underutilized and undervalued by many doctors since few do it comprehensively and properly, even when it's really called for. For example, if a doctor's listening to your heart and or lungs through a papery gown, they'll hear the basics of what they need to hear. But it's all eclipsed by a crackly rustling sound of the paper that can obscure minor extra sounds. Another example, if you're having any kind of neurological problem, they should likely be doing a head to toe full neurological exam, at the least at the start of the problem, which can take some time. But being rushed is no excuse not to do it. Thinking it's unlikely that you'll find anything new on a patient you're seeing each day is no excuse either. However, again, in their defense, as I've said a million times, doctors are so woefully short on time, mostly through no fault of their own. But at the end of the day, they have to remember what they're there for and that doing it right is really what matters. All in all, this experience was utterly exhausting, physically and mentally, for my relative, and for her husband, and for me. We were completely drained at the end of each day from the combination of the illness, the worry, and the mental strain involved in simply trying to understand everything going on and what it meant for her and them as a family. I was so happy that I could do this for my relative. But of course, medical care should not be set up so that the patient or their family member needs a doctor's degree to understand it. As I've said many times, it's really useful to have a doctor friend you can reach out to if something like this happens to you. But if you don't have one, I'm going to give you some tips on what you could do if you have a relative or friend in the hospital and you want to help them out. You'll be what's called their advocate. Before I start my list, my most important advice is do not feel bad about doing any of the things I list here. Patients and their advocates have the basic right to get help and information. I know you might feel like you can't always ask for things or that someone will get annoyed at you, but that's really not how it works. Hospital staff want to take care of patients and help them, even if it doesn't always look the way you want it to. So, first, take notes on everything. Which doctor or staff member, like physical therapy, for example, is coming in the door? What's their role? What is their specialty? What are they saying has happened or is happening? And what they want to do about it. Probably a lot of this is new for you and the patient, and you won't remember it all later as well as you think you will. If they say something that you don't understand, ask for clarification. You can even ask them to spell things out if you need. Ask them to repeat something if you need them to. And lastly, don't feel bad. Second, if the patient needs something, just push the nurse button or help button. Every patient in every hospital has one of those. Response times vary widely, but someone should, at the very least, ask over the speaker in the room what you need within about a minute. I mean, someone could be having a really urgent problem and they have no way of knowing that until they ask. After they hear what it is, they'll let the appropriate person know about it. If it's not urgent, it might take a bit for someone to finish up what they're doing and get there. Try to be patient. If it's not urgent and 10 minutes go by, push the button again and ask for an update. If it is urgent and no one comes within a couple minutes, push the button again and ask for an update. And don't feel bad. Third, if anyone has questions, patient or advocate, actually ask someone. You can always start by asking the nurse, and they'll often know the answer right off the bat. Also, they act as a go between for the patient and doctor. If they can't answer the question, ask them to call the doctor and request a quick visit. The way it works with doctors in most hospitals, regardless of size, is that they physically come around about once a day to interview and maybe hopefully examine the patient. As the advocate, you may or may not have been there when the doctor came in. But if you miss them and have a question that no one else can answer, you are allowed to ask that they come explain what's going on. It might take them a long time as they work off of a priority list and are tending to the most urgent problems first. But don't feel bad to ask. Fourth, you can ask that your family member be as comfortable as possible, warm, fed, and with pretty good pain control. If you think something is lacking in any of these categories, ask the nurse for some help. Warm blankets are usually close by, and they have snacks on most hospital floors to supplement the meals. Good pain control is usually possible. If someone's in pain and they're not receiving something for it, ask for something to be given. If they are getting some kind of pain medication and it's not working, let the nurse know. There are almost always alternatives to try or dosages to change. And speaking of comfort, you can bring in some things from home to increase someone's comfort usually. It could be food that they like, or their own pillow, their favorite sweater or slippers, a book, and more. Definitely ask the nurse first to make sure that they don't have any rules at their hospital about these things or restrictions for the patients that you might not know about. Fifth, if a patient is really sick and has something complex, and as their advocate, you feel like the patient and perhaps you are not quite understanding what's going on despite following all these other tips, one of you can try calling their primary care doctor, assuming that they're not already involved. The benefit of getting a primary doc involved is that they might be willing to be a go between for you and the hospital doctors. In addition to having potentially useful, deeper understanding of the patient's medical history that they could pass on to the hospital docs, they can also call them directly and get detailed info that you probably can't. Or if they're on the same electronic medical record system as the hospital, they might be able to see all the test results and could explain those too if needed. One thing they can't do is dictate the care of a patient in the hospital, unless it's a hospital that's set up that way. These are becoming less and less common, but point being, a primary doc is another type of advocate for their patients. Yet another reason to have a relationship with one. Not all doctor offices are set up for this kind of thing. For example, maybe it takes 2 days to get a message through to your doctor, or maybe they're simply too busy and don't offer that service, but it's worth a try if you think it might help. And don't feel bad to ask. Last thing is administrative. Have the patient's health paperwork in order. I mean, you have to ask them about it. This could involve a DNR. It's called a Do Not Resuscitate Order. This is also called an advance directive. It outlines what the patient wants done in case they stop breathing or their heart stops. Some people want all-out effort to be made to resuscitate them. Some don't want any effort at all to be made. It's a very personal choice, and it's important that doctors involved in their care know this information. There's also a power of attorney for healthcare, which lays out who is responsible for making health decisions for the patient if they're incapacitated. It's good to do these paperworks anytime in your life. Best not to wait until you're regretting not having them. When you are admitted to a hospital anywhere, they will ask you for these. All right, that's my starter list on how to help advocate for a patient in a hospital if you're not a medical person. I'm sort of sad that I need to make this episode and outline these tips, but this is where we're at. Healthcare has become so complex, and communication is in many ways harder than it was in ye olden days when it was really just doctor, patient, and sometimes nurse. And the only way to communicate was face-to-face communication. The rise of technology is both helping and hurting the doctor-patient relationship. The rise of for-profit ownership over healthcare is hurting everyone but those for-profit companies. The rise of health insurance and billing complexities is making it hard for everyone, including, I think, even the companies designing the complexities. So with all of that, patients need some help so that they can just be patients when they're sick in the hospital. They need better communication and coordination from the hospital and healthcare system, and ideally, they have someone helping them keep it all straight. And that might just be you. I'll be back later this year with season 3. In the meantime, I'll be working on a curriculum for young adults to learn how to navigate our convoluted health system. If you have thoughts about that and want to be on the show next season to talk about it, let me know through the podcast website, www.drpatientpodcast.com. If you haven't already done this, please consider signing up for my newsletter at the same website. I send tips and alerts about new episodes. And as always, thanks for listening.
Thanks for listening today. To catch up on more episodes and to get new ones delivered directly to you, subscribe wherever you find your podcasts: Apple, Google, Spotify, iHeartRadio, and more. If you'd like to be a guest or have an idea for an episode, let me know at www.drpatientpodcast.com. That's drpatientpodcast.com. Here's the disclaimer. Even though I am a doctor, I'm not your doctor. These stories, my comments, and all discussion is purely reflection about what's working in the healthcare system and what isn't. Don't use any medical information that you hear in these episodes to diagnose or treat yourself. If you have a question about your health, get in touch with your doctor or local health clinic.